Before you begin this secondary assessment, remember to be safe and protect yourself from bodily fluids by using gloves. Use your eyes and hands to find any abnormalities or possible problems. To begin, you will need to remove any unnecessary clothing. As you do so, constantly scan the body. Remember to keep them warm. Additionally, do your best to preserve the patient's modesty. Start feeling at the head for deformities and watch for any fluid that may be blood or other body fluids. Note any reaction to your touch.
You should also scan the person's ears and nose for blood or any fluid. From there, slide your hands down the person's neck. You should know the mechanism of injury to know if a head or neck injury is likely. Press lightly on the person's face with your fingertips to see if there are any broken bones underneath the skin.
Feel the front of the neck for air bubbles or a crackling sound coming from underneath the skin. This would indicate a subcutaneous emphysema, which is caused by air bubbles escaping from the lungs and chest cavity. Not an emergency in and of itself, but it is an indication of lung overexpansion injury and can also be caused by traumatic injuries.
Next, scan the person's collarbone for injuries or discoloration. Press your fingers along each collarbone individually to check for movement or reaction to your examination.
Moving down, re-examine the chest. Hold one hand on the side of the chest while you press along the other side, searching for broken ribs. You should note any open wounds. Divide the abdomen into 4 quadrants. Press on each quadrant in turn to check for any areas that are sensitive, hard, or painful.
Next, place a hand on either side of the pelvis and gently push the sides together. Press down as if you were pressing the person's pelvis into the ground. Note any instability or painful response.
Finally, examine the arms and legs, pushing hard enough to feel the bones beneath the skin and muscle.
Immobilize the arms and legs by holding the person at the ankle and wrist and ask her to wiggle her fingers and toes.